taking a second. Give me a minute.
All right, in the meantime, I think I'm going to go ahead and share the screen. I don't think there's.
That would be great.
All right.
Hang on, we're almost there. It's a little slow today. We'll see, maybe this isn't going to work for us today. It's saying it's unable to stream. So
well,
I think
why don't we
just,
we'll get started and then we can always try.
We are recording it, so I think we'll just get started.
Great.
Go ahead, Caitlin, I'll turn it over to you.
So the screen is shared now. My name is Caitlin. I am the project coordinator, as Sally said, for the Living Well project. And we have put together, through the Living Well grant, a toolkit for things to do during COVID-19. They're separated into different sections. So we have Stay Healthy, which we talked about yesterday. And that recording is available if you weren't able to join us. The Stay Safe option or section is the one that we're going to go through today. And then Stay Connected, Sally is going to walk through tomorrow. In the toolkit, there's also a frequently asked questions section, and we are adding to that all the time, and we're making updates to the whole toolkit as we get more information from people. And then we'll give Mitch a chance to talk about Disability Rights Wisconsin a little bit, and then the other part of this that we are going to go through is the My Safer at Home plan, which we think fits really nicely with the Stay Safe section. It gives you the opportunity to make a emergency plan and make sure that you have everything that you need. So this is the front page of the Living Well toolkit. It looks like this, and you can download it from the website, or we put the link on Facebook quite a bit. We can send it to you or even put it in the chat here. And so we're going to skip down to the Stay Safe section. We'll go past Stay Healthy. It starts on page, what page is this? 6. It starts on page 6. So the first page gives you just a couple of quick bullet points on the COVID-19 outbreak and what you can do to stay safe if you need more assistance during this time. So COVID-19 has changed how we're living and working. As you can see from our screens, we're all at home and unable to get together. So, you know, but it's important that while we're alone, we're still able to stay safe. So some of the things that you can do if you feel like you're not safe or you need more support is you can, if you're in family care or IRIS, you can call your care manager or your IRIS consultant to ask them for the additional supports that you feel that you might need to stay safe while you're social distancing. And that number should be with your member handbook or your participant handbook or participant guide if you don't know it or if you haven't used it in a while. The other option is is you can get in contact with your ADRC or Aging and Disability Resource Center. They can help you if your situation has changed, and there is a number for your Aging and Disability Resource Center listed at this link here. There's quite a few because it's by county. So you just look up your county and then you can get in contact with them. The other thing that you can do if you want some more resources that are specific to your area is you can call 211. They often can give you information about things in your area, like if you're having issues with housing or if you need food assistance. they can sometimes guide you to the right place. They are having a lot of calls right now, so they suggest that you try texting them first, and you can text COVID-19 to 211-211, or visiting their website at 211wisconsin.org before you call, just because there's a really high call volume, and there's a chance that if you visit their website or you text them, they might be able to give you some more information that way first, and then you don't have to wait on hold for so long. If you're having trouble with your mental health, or you're having a mental health crisis, there is county crisis lines that you can call. We have the numbers listed at this website. There's also a disaster distress helpline with the number listed here, or you can text "Talk with Us" to 66746. If it's an emergency and you need immediate assistance from somebody, you can always call 911. All right, so that's a lot of information, but like I said, it's all listed on the toolkit, so you don't need to access all of them, just the ones that you need. So the next page in this part of the toolkit is about the rights that you have while COVID-19 is happening. And these are rights you have all the time, but in particular, we think it's important that you get to see that you still have these rights even as these things are going on. So COVID-19 has made the way we live look a little bit different, but that doesn't mean that you don't have the right to be safe in your home. You still have the right to be safe in your home. You still have the right to be free from abuse and neglect. You still have the right to the services and support that you need to be healthy and safe. You still have the right to tell your care manager or your IRIS consultant if you are unhappy with a service, or if you think that you need a different service. And you still have the right to get help from your doctor or a hospital, and they cannot refuse to take care of you just because of your disability. And you have the right to save life-saving medical care if you get sick with the virus. So those are all things that you still have the right to while this is going on, and those are rights that you should be able to access whenever you need them. If you feel like you don't have access to those rights, or they're being taken away without your participation in that conversation, then there are some things that you should do. One of the things that you can do is call or email your care manager or IRIS consultant if you are in family care or IRIS. If you don't have family care or IRIS, or you don't have a care manager or IRIS consultant, or if you've reached out to them and you aren't hearing from them, there are still other options that you can access to make sure that your rights are being protected. And we're going to go through some of those options in our in these next couple of pages. So the next page is how to report abuse. So if your rights are being taken away, or you're experiencing abuse and neglect, which can be physical, sexual, or mental abuse, or financial abuse, then there are some things that you can do to make sure that that situation changes or stops. The first thing that you can do, and that's here, is tell one or more trusted adults who can help you figure out how to report what's going on. That could be a family member, a close friend. It can be your care manager or your IRIS consultant if that's somebody that you trust. But telling somebody who can help you is an important first step. The second thing that you can do is you can call your local police department if you are in immediate need of help, or if you are in danger. So if you are experiencing something that needs to be addressed right now in this minute, then calling the police department at 911 is a good option to make sure that you can get to safety quickly. If it's something that needs to be addressed, but it doesn't mean that you are in immediate danger, you can always call Adult Protective Services. and they can help you, and they can investigate what's going on and see if they can help stop the situation. Every county has a helpline. This is available across Wisconsin, and the numbers for those helplines are listed in this toolkit so that you can find your county and then call them and see if you can get some assistance. We also have them listed at the website that they are that all the numbers are listed at in this toolkit here. And you can either look it up by that website, or like I said, it's in the back pages of this part of the toolkit, so you can always just look up your county and the numbers that they have available. And I'll give you a couple of examples of that as we go through this. So, like I mentioned before, there are different kinds of abuse and neglect. Some of the examples of that are physical abuse, which could be hitting, pushing, or shoving. Emotional abuse, if people are bullying you or saying mean things to you, or saying or posting pictures or doing other things that are hurtful to you that you did not give permission for. There can be sexual abuse, which is when somebody is touching you when you don't want to be touched, especially in private areas of your body. Financial abuse is when somebody is using your money and your resources for themselves and not for your needs and supports. And then neglect can be when somebody's not taking care of you the way that they are supposed to, or you're struggling to take care of yourself. And this can be one of the biggest ones that people face while we're all separated from one another, because it's a little bit harder for us to get to one another. And if we're stuck in our homes, it might be harder for us to take care of ourselves. So those are different things that can be happening to you, and they will, those are reasons that you should talk to a trusted adult, or talk to your care manager or IRIS consultant, or call somebody like your Adult Protective Services helpline. Now, talking to people about this stuff can be really, really difficult, and we want to make that a little bit easier for everybody. So part of what this toolkit does is it creates a plan of action. So it breaks down all of the things that you would have to do to talk to somebody about these difficult things in some pretty easy steps that will make it a little bit easier for you to share the information with people. So this is the My Plan of Action, and this can be downloaded as part of the whole toolkit, or it can be downloaded separately as an individual fillable form. So if you just want to print this page out, you can do that from the website, and I can show you how the website looks in a minute once we get through this part. So this is the My Plan of Action, and it's got, I think, 4 steps. It's got 4 steps to do to make a plan if you're going to tell somebody about something that's happening to you that you think needs to change or stop. The first is, like we talked about, deciding who you're going to tell. That can be a person you trust, it can be the police, or it can be somebody like Adult Protective Services. So you can decide who are you going to talk to first about what's going on. The next thing is, how are you going to talk to them? Right now, because we're all at home, the safest way for you to talk to somebody about what's going on is to call them on the phone, or maybe send them an email if it's something that you think you can do over email. But going to meet with them is something that you should save only if you are in immediate danger, because going and meeting with people right now is one of the ways that the virus spreads, and so it might not be safe for you to go and do that. So we are suggesting that if you can, you should call them on the phone first. The next thing that you're going to do once you have decided who you're going to tell and how you're going to tell them is planning out what you need to say. So some of the things that you should think about when you're planning out what you're going to say is, who did it happen to? Did it happen to you? Did you see it happen to somebody else and it's causing you, anxiety or fear? Who was the person who did it? What happened? When did it happen? Where did it happen? Was there someone else there? And is there anything else you want to tell them about the situation? You don't necessarily need to have answers to all of these questions. You can fill out as many of them as the information you have answers, but breaking it down this way can help you remember all of the things that you think are important to share with somebody. And then the fourth step is, what do you want to happen next? There are some things that you can ask for so that you can know what's going to happen next, or request what should happen next to you. Is it most important for you to keep yourself safe? Do you want to leave the situation? Do you need somebody to be checking on you more regularly? Do you want more information about the rights that you have? Do you want to work with an advocate to help you tell this story to other people who need to know about it? Do you want more ways to protect yourself? Or do you need somebody new to support you? This is not just a check one box. If all of these apply to your situation, you can certainly check more than one. And you can also write on there which ones are the highest priorities for you, which one is the most important one for you to have happen, and what's the second most important, things like that. So like I said, this is a form that you can download. You can have a couple of copies of this if you need them. You can print several of them, or you can also fill it out on your computer or tablet. These boxes will check off, and then you can just fill them in as you are working through this plan. This is not a plan that you have to do, but it will help you if you need to talk to somebody, especially if it's somebody that you haven't had to talk to before. We know that calling somebody like Adult Protective Services is a big step to take, and you might not know those people, and that might cause you some anxiety and fear. And if you have a plan of what you're going to say to them, that might help make that seem a little less scary. So once you've called somebody, you're going to want to keep track of who you called and when that was, because you might have to make more than one phone call, and somebody might ask you if you've talked to somebody else before. And the best way to make sure that you're keeping good information is to record all the phone calls that you make about a situation. So in this page, it gives you options to write down what you've done. Who did you call? When did you call them? Did you leave them a message, or did you speak to them, and did they give you information over the phone? And who was it? What was their name? What was their job title? And you can ask those questions of the people that you talk to. You can always say, who am I speaking to, and what is your role, or what is your job? And then you can write down what they said. If they gave you information on what to do next, then you can write that down under the what's next section. If you got a message and you left somebody a message, then you can plan to call back another day, unless that person gets back to you right away. It's okay to call a couple of times. And then once you do talk to somebody, decide what the next step is going to be for you. Are they going to follow up with you? Are you going to follow up with them? Is there another person that you need to call? If you talk to somebody, you can ask them what they think the next step is for you and what they think the next step is for them. And that way you can know what to expect in the coming days or weeks after you talk to somebody about this. And you can again print this sheet out separately. You could have a couple of them because you might have to make a couple of phone calls, and that's okay. So you can always have a couple of these on hand, and that way you have a nice record of the people that you've talked to and the things that you were able to tell them and the things that they were able to tell you. So that was a lot of information. I know that it was a lot of information, and we tried to break it down into some easy steps, but it's not a perfect process. It's okay if you use parts of this, or you just use the helpline numbers and you make your own script about what you're going to say to them. All of that is fine. We just want to give you some resources to break this down into some manageable steps if you need more help. So this is the county helpline section. After those sheets in the full toolkit, it lists all of the county numbers for adult protective services. These are the numbers that you can call if you need the county in your area to talk to you about what's been going on. Some of them have after hours phone numbers that are different. Sometimes they have hours that they're available during the week, so 8 a.m. to 4:30 or something like that. Some of them have one 24-hour number, and that you can just call the same number anytime. There's some good information on here about when you can expect somebody to be available at these county lines. That might be a little bit different as we're going through COVID-19, but I don't think it's too different. APS is still working. They're still considered to be essential employees, so they're going to their jobs and they're going to be available to you if you make a phone call. So you can see Douglas County, Lincoln County, all are listed here. And that way you can find the county that is where you live or where you receive services, and you can highlight it, or you can cut this part out and put it on your fridge, or you can write it in your My Safer at Home plan, and that way you know what number is the right number for you. So that, again, that's a lot of information, but you don't need to print all of these pages because you just need the county that's best for you. And then the other resources that you can reach out to if you're having some trouble getting your needs met or having your situation of abuse and neglect addressed is Disability Rights Wisconsin. And this is where I'm going to turn it over to Mitch and give Mitch the opportunity to talk a little bit about what Disability Rights Wisconsin does and how they might be able to help you if you are struggling to get your situation resolved.
Hello, everybody. This is Mitch Agopian. Thanks, Sally and Caitlin and Shannon, for including me in this thing today. I'm an attorney with Disability Rights Wisconsin, and we are the protection and advocacy agency for people with disabilities in Wisconsin. We get that designation from the federal government and from the state government. And in addition to that function, we are also the Family Care and IRIS Ombudsman Program, which is a specialized advocacy program for people who are having problems with their family care MCO or with their IRIS benefit. So at the moment, all of us are working from our homes, as you can see. So the whole agency is dispersed all over the place, but we're still completely functional and able to receive calls. So a couple things, especially because a lot of folks are on either family care or IRIS. We have a number of full-time advocates in our Family Care and IRIS Ombudsman program, and they're available to continue to field calls about problems with family care or IRIS, and especially, in this context, things that are changing because of this COVID outbreak. So as Caitlin has introduced in the toolkit here, one of the things you have the right to do is to seek additional or more services, new ones or more of the same service from your family care or IRIS program if you feel like you need them in this circumstances. So you always have the right to do that if for some reason you think because of the changes that you've had to make because of the COVID outbreak, that you might need a different service that you don't have right now under family care. You should, first of all, be contacting your family care case manager or your IRIS consulting agency and inquiring with them about, what else might be available. And then if they're not able to give what, respond the way you want, like they can't give it to you or they're not going to give it to you, then you can call our ombudsman program for assistance. So, an example of this might be if you're a person who's normally getting, as like 24-hour support, and that support's become, people are not showing up all the time. You probably need to be getting in touch with your case manager, your consultant, and making sure that they're doing what they can to ensure that your plan is staffed and the people are there to take care of you. And if they can't do that, that they're looking at potentially other ways to make sure that you're at least protected in the event of a real emergency. So, maybe it's time for them to get you hooked up with a personal emergency response system so that if someone doesn't show up and, you have trouble using the phone or something, you could get service that would be voice activated or something like that. So there's things that can be done. This is a really bad time for everyone. All of the folks who are vulnerable. It's difficult for the provider agencies too. We got people who are sick, who shouldn't be coming into people's homes, and there aren't people to substitute for them. So we all have to be patient with everybody, but it's not a reason to be subjected to abuse or neglect. So again, problems with family care or IRIS, you can call us, and our Family Care and IRIS Ombudsman program will be able to respond to your concern. As the protection and advocacy side, we're here to help prevent abuse and neglect of people with disabilities. We're not a crisis agency. If you're in crisis, you got a worker who didn't show up and you're in need of help now, you need to be contacting the police or your adult protective services agencies at the numbers that Caitlin has introduced you to earlier. But for things that require a lesser response or not quite as immediate response, we are available to look into that. And so one of the rights that Caitlin was talking about is the right to get medical care during this crisis. And I think a lot of people are concerned about that, and we as an agency are very concerned about that. And so one of the things we're doing right now in our work is working with the people who are deciding who is gonna make decisions about who gets medical care. Like if you go to the hospital and you need a ventilator because you're really sick with the virus. Pardon me, my dog's in the background. But if you're really sick with the virus and you may need a ventilator to help you breathe, we're trying to make sure, and we're fighting for people's rights to be sure that the, some dumb dog, but she's watching out for me in this time of need. That's all I'll say. But we're making sure that the policies that get developed that decide who gets this equipment don't discriminate against people with disabilities. So we're participating in every possible way that we can to make sure that doesn't happen. So if you're in a situation where you have to go to the hospital or a medical facility and you think that something like that's happening, like they're denying you medical care because you're a person with a disability, contact probably I suppose the police, but that'd be something you would definitely want to be trying to contact us about also, because that's an area where we do have specialized expertise. We can't staff a 24-hour helpline. So if it's happening to you in the middle of the night at the hospital, you're going to have to call somebody else. But if we have a message the next day, we'll be able to look into it. I don't know. Does that seem like a decent enough introduction to what we do and how we do it?
Yeah, absolutely. The number for DRW is listed in the toolkit. So if what's happening to you fits into the things that Mitch was saying, then that number is available for you to use. And like he said, they will help if they can. I think that this is a good place to stop and take some questions, and then we're going to go through the My Safer at Home plan, which will give you sort of a proactive tool to use to make sure that you're safe, and whereas this is a little bit more what happens if you're not safe. So if there's questions, I think this might be a good time to take a couple.
So this is Sally. If you have a question, you can put it in the chat. I did have one question from Facebook. So it's somebody who receives disability, I assume disability payments, and they live in some type of subsidized housing. They said that they don't get any of their money, no allowance. Would this be considered financial abuse?
It probably depends on the circumstances, and unless someone else wants to chime in here. Without a little bit more information, it's hard to know why that payment wouldn't be going to the person. But if for some reason the subsidized housing provider is like your representative payee, and they're supposed to be releasing money to you, then yes, that would be financial abuse. Since it involves Social Security payment, you can call the Social Security Administration about that, or you can also call the ADRC and see if you can get some help from the disability benefit specialist in your county. They also handle problems related to Social Security and SSI benefits.
Yeah, and I think the thing that I would add is that you have the right to participate in conversations about what's happening with your money. So if you are concerned, then you have the right to talk to some people about what's going on, and they might be able to give you more information or explain things in a way that makes a little bit more sense than the situation feels right now. And if you feel like you're not able to get more information from the people who are involved, then that's something that is a little bit of a red flag, because you have the right to participate in these conversations about what's happening with your money. And it might not mean that anything needs to change, but if you need more information, you have the right to ask.
And the person did put that the payee is a different person. So I think it is an issue with possibly the payee, and maybe that's a place to start.
Yeah, that might be a good place to start.
Yeah, definitely. I mean, it could be that the rep payee normally gives money to the subsidized housing provider to get to the person or something like that. And in this outbreak, it's hard for that to be arranged. But it's the representative payee's responsibility to make sure you're getting your regular spending allowance. So definitely contact that person first.
So Mitch and Caitlin, I'm not seeing any questions in the chat for you so far based on what you've discussed. Just so everyone knows, you can access the chat. It's usually down at the bottom of your screen if you have the full screen on your computer right now. So if you do have any questions, go ahead and put those in. But Caitlin, if you want to go over the Safer at Home plan, and then we can see if there are other questions or comments.
Sure.
that you make.
Yeah, absolutely. All right, I'm going to share my screen again, and I'm going to go to the My Safer at Home plan. Okay, so this is another tool that we have worked on since the COVID-19 outbreak. We've been hearing a lot that people have like a plan, maybe if there's a fire at your house, or a plan if you feel like you need to call the police, or something like that, or if there's a natural disaster. But this is a very new type of situation that we're in, and a lot of people, us included, we didn't really have plans for how we were going to deal with keeping ourselves safe and healthy while this was going on. So this is the tool that we've developed, and we might make changes to it based on suggestions that you guys have for us. But it's a way to make a plan for being safer at home. And some of these things are going to be relevant just while we are in this special situation. But some of this stuff is really things that it's good to know for your everyday life, even after COVID-19 is done. this is a good way to make sure that you have the things that you need to be safe, no matter what happens. And if you don't have these things, it's a good conversation starter for the people in your life that support you or that you trust, to make sure that you are as safe as you can be in your home and in your life. So there's some things that you definitely need if you're going to be safe in your home. And those things include having food to eat, having the medications that you might need, having things to stay clean like shampoo, soap, toilet paper, having a house that has heat and electricity and running water, having the services and supports that you need and when you need them, and then having the ability to move around and use the things in your home or have help, the help you might need to access those things in your home. And then you need to have, if you need help from other people, family givers, if family members or caregivers aren't available to you, then that's something that you need to be safe in your home. And while we're social distancing, it might not be possible for the family and friends who would normally come and do things with us to safely come to us. And if that's changed for you and you need help from somebody else, then you need to ask for it, because that's really important to be safe in your home. And then having a way to call for help if you need help. So that might be having a cell phone or having a phone in the home that you have access to, or it can be something like having a tablet with access to Facebook or another way to contact. However you communicate best with the people that you trust and those who support you, having access to that during this time is a very, very important thing to have. So you should, if you print out this document, which is on our website and part of the toolkit, you can print it out and you can put an X by the things that you do have. And if you have boxes that are left open, then that's something that you should talk to somebody about. So down here it gives you some things about whether or not your home is safe. If your home is safe, then you have all the things on that list that you need, and you also have and then you have the ability to get those things in if you don't have them in your house right now. So somebody to go to the grocery store for you, or access to a grocery store or to a food delivery service. So if you don't have them right now, if you have a plan for how you can get them into your house or how you can replenish them as they run out, then your home can be safe. You should only leave your home to get things like food or medicine. And if you leave, you need to make sure that you can stay 6 feet away from people, have the opportunity to come home and wash your hands, and that kind of thing. So if you don't have a safe way to leave the house or a safe place to come back to, that's something that the people who you trust need to know, so that they can get that in place for you during this time. So if your home isn't safe, then you should call your emergency contact your care manager or your IRIS consultant, or if you're having an emergency, you can call 911. So when you would call 911 is if someone's being hurt, or if you need immediate medical assistance, or somebody is in your home who shouldn't be there, or if there's something like a fire. Those would be good reasons to call 911 and not wait to call somebody like a emergency contact or your care manager, because they can't help you as quickly as 911 might be able to help you. These boxes here are a good place for you to write down the name and number of some of your emergency contacts, people who you trust, who you think would be available no matter what to come and help you or to answer your call in an emergency. And then the name and number of your care manager or IRIS consultant, if that is somebody who you feel like you can safely reach out to. The second page of this plan is just some conversation starters for for you to have with your emergency contact or your care manager or IRIS consultant, to think about how your life may look a little bit different now because of COVID-19 and what that means for the supports and services you might need to be safe while we are all in our homes and social distancing from one another. So you can talk about how your day has changed, what kinds of things you want to do now that you can't go into the community or can't have access to the same people that you had before. If you have to keep working or if you can keep working, what does that look like? What happens if your job has been stopped because of having to be at home? What are your options for finding another job, either now or when this is all over? Also things like, where are you going to get your food? Can somebody help you with that? What's a safe way for that to happen? That's the same with your medicine or medical supplies. And then another important part, which Sally's going to talk a lot about when she does the Stay Connected section tomorrow, is how are you going to connect with people now that you're at home? How can you make sure that you have the resources you need to still have relationships with people now that we're doing things like Zoom calls or phone calls instead of in-person meetings? So, do you have a computer or a phone or an iPad? Is there somebody in your life who can help you get access to those things? Maybe your care manager or IRIS consultant or somebody else. And then what should you do if the people who normally you spend your time with or who are helping support you, if they get sick, is there going to be somebody else who can step into that place and make and do those things that the family member or caregiver were doing and still make you feel safe? You know, it's important to have a conversation about, you know, if it's usually a family member or a caregiver that you've known for a long time and they get sick, how can you make sure that the new person who's coming to help you, if there is a new person to come and help you, is somebody that you can feel safe with supporting you? That is a right that you have to have that conversation. And then finally, one of the questions that you can have with, one of the conversation starters you can have with your care manager or your IRIS consultant or a trusted family friend or family member is, are any of your rights being restricted? And we went over some of what those rights are on the one of the earlier pages of the toolkit. So if some of those rights are being restricted, it's again a conversation of who's doing it, why is it happening, and to reiterate, you have the right to participate in conversations about if the right is being restricted, what the plan is for you getting that right back, or changing the situation so that that right is no longer something that's been taken away from you. As you have these conversations with the people that you trust, this section at the bottom here is a good place for you to write down your plan. You know, the answers to these questions, what solutions you guys have come up with. So we've broken it down into a couple of categories for you. My food and shopping plan. So that answers this would be a place where you would answer the questions about where you're going to get your food from, where you're going to get your medicine from, is it going to get delivered? Whatever solution you come up with, this is the right place to put that down so that you can remember what the plan is for you to have the food and supplies that you need in your home. My work and or activity plan. If you've talked to somebody about getting some technology that you didn't have before, this is a good place to write that down. It's a good place to write down the important information that would come with that, maybe like a password to something or the username that you're using, and then what other activities that you think would be things that you would like to try or can try while you are in your home and unable to go into the community as you were before. My backup support plan is that part we were talking about when if the person who normally helps you or gives you support isn't available because they get sick or because they can't make it to you anymore, what kind of backup support is available? What's that person's name? How do you get in contact with them? What's the best way for you to get the support as quickly as possible. And then in the next column, the My Health and Medical Plan. This is a good place for you to write down the name of your primary care physician or your doctor. It's also a good place for you to write down what you want to have happen if somebody needs to call an ambulance for you and you're not able to communicate how you normally communicate with people. It's a good place to say, you know, if you have to call an ambulance, I'd also like you to call this other person, or I'd like you to tell the ambulance driver this thing about me, or I would like to tell the ambulance driver this thing about me if I have the opportunity to. That's just a good place for you to write down the things that are important to share with your and maybe not all of the things that you would want to share, but who you trust to share them, or what opportunities you would like to have to share the important information when something happens or when you call the doctor or something like that. And then the My Staying Connected to People plan is much like the My Work or Activity plan. It's again a way to make sure that you are not feeling alone during this time and that there are options for you. And then My Emergency plan is who are you going to call first in an emergency, kind of like what we talked about earlier. And also, where are you going to go if it's something where you can't stay in your house? Is there the place that you go when you have to leave? If not, is there a police station nearby or some other safe place where you can get to? And if you don't have to leave your house, then who are you going to contact first about an emergency so that you can get back to safety as quickly as possible? So that is the sort of companion to this. It touches not only on the safe part of being of what's going on right now, but it's also the connected part and the healthy part. All these things are very much joined together in creating a healthy and safe life while we are in this special situation. But these are also things that you need no matter what. You really always should have a backup plan for who could help you if a family member gets hurt or is sick. You should always have a plan for ways to stay connected to people and ways to get the medical supplies, medical care, or food that you need. So it's very important right now, and it's a really important conversation for you to be having with the people that you trust right now so that you're safe. But even after COVID-19, social distancing, safer at home, all of these things that we're talking about right now, as those start to go away, this is still really important information for you to know about your situation so that you can be safe no matter what's going on. Okay, I think that that's enough of me talking for a little while. I feel like if there are questions, we're more than happy to answer questions.
Yeah, there's no more on Facebook or in the chat. So what we did yesterday was we did open up the, we did unmute everybody and allow them to ask questions because we know sometimes technology can be different. Before I say that, just so you know, we are doing another presentation tomorrow at the same time at 11 on Stay Connected. I'll be doing that presentation along with Ashley Matthew, who is a self-advocate with the Living Well grant. So I'm going to unmute everybody and give people the opportunity to ask a question. Here we go. All right, you're unmuted. Does anyone have a question?
Program.
Looks like Emily, I can't hear you very well if you're trying to ask a
So
question.
I can send in the paper.
I'm not trying to ask a question, but I can't get my video
And
on.
they will reach out to you and send you what you need to do to start working
Oh,
on.
it sounds like somebody's doing some work in the background. Let me mute that
So there'll be some paperwork that you have to fill out. And you'll have to talk to Ruth and see if she is able to.
I'm going to mute everybody just for a minute. Emily, did you have a question?
No, I do not.
Okay,
I don't know.
that's
I
fine.
think it's because I'm trying to get my video to show up. You're probably thinking that I'm
Okay.
talk or something. I don't
While we're waiting, I did want to just share with you, this is what the BPDD Living Well page of the website looks like. The full toolkit, which is what we were using to go through this today, is listed on the first tab, but we've broken each of them into their individual sections. And we're in the Stay Safe section, and we've got some of those resources for filling out just those individual sheets listed on this part of our website. You can download the whole section, the whole toolkit, or just those pages in different places on this, this tab menu here. And then the My Safer at Home is its own tab, and you can download that from this button here, and that is its own document as well. So if you don't want to have to keep downloading the whole, I think it's like 22 pages of the toolkit, we have ways for you to just access the individual pieces. And if you go to our homepage, just the front page of the website, there'll be a link there that you can get to this part where you have individual sheets. I just wanted to make sure that I shared that with you.
I do think that Zoe had a question, so I'm going to unmute her.
Sure.
Maybe.
Zoe, we can't hear you quite yet.
It's not letting me unmute her.
I'll give it a try. There, I just unmuted her.
Can you guys hear me?
Now we
Yes,
can.
Zoe.
Yeah.
Perfect. Good morning, guys. I'm calling all the way from Portland, Oregon.
Oh, wow.
Great.
Did you have a question?
Yeah, I have a question. So this is for Mitch. Can I just ask my question just for Mitch?
Sure. Can you hear me?
Yeah. Good
Okay.
morning, Mitch. It's Zoe.
Hi.
I have a question. So basically what
Hello, this
you
is Sarah.
said is that you said the federal government, which means people that have the Family Care Act, right?
Well, in Wisconsin, I don't know about Portland, but Wisconsin, we have a program called Family Care.
Okay.
Help people with disabilities stay in their homes.
Okay. And so I was just wondering basically like what you said so I can just get it in my notebook.
Okay. Well, we have a program called at the Disability Rights Wisconsin, which is where I work. We have a program called the Family Care
Mm-hmm.
Iris Ombudsman Program.
Mm-hmm.
And that's basically advocates who can help people who have problems with that program that helps people stay at home, which in Wisconsin we call Family Care or IRIS. We have two of them.
No way. I didn't know about that.
Yeah, we're one of the few states who has one of those advocacy programs. I don't know if Washington does or not, or Oregon, but
I have a question just for
And-
Caitlin.
Sure.
And Zoe, I can connect with you later to give you more information about that.
I have a question just for Caitlin.
Sure.
Okay.
And for I didn't get your name again. The one in the blue shirt. Shannon, right?
Oh, sure.
This is for both of you.
Okay.
I have a quick question. So what you said is, can you recap what you said? I didn't get all of it. What you said.
Sure, and we can also like send you the pieces of the toolkit and stuff, and we can give you some more information that way too. But basically, this toolkit is designed to give you the opportunity to write down important information about staying safe and giving you the right numbers to call if you need something that you don't have right now. And it's pretty Wisconsin specific for some of it, like the county helplines are just the counties in Wisconsin. But that doesn't mean that there aren't the same options where you live. It just is going to be a different website. And there are places similar to like our APS, our Adult Protective Services. There's probably going to be something even in Washington where you can get those numbers. So
Right.
This is just so that you can get the right resources in case something happens to you, and making a good plan to prevent bad things from happening to the best of your ability and the people who you trust.
And Zoe, I did mute you because I think we're going to see if there's any other questions because we're kind of getting to the end of the time, but go ahead, Shannon.
I was just going to mention that we have recorded this so it's on the Facebook Live, and we also can send a Zoom link for anyone who wants the full recording.
Yeah, that's a good point too.
So do we
Can I
have
ask a
any other?
question? Can you hear me? This is Emily.
Yes, we
Yeah,
can hear you,
hi.
Emily.
Okay, so for the 2 plans that Allison went through, the one that has like the blocks with your food plan and all that, is that a link you clicked on, or is that just in the toolkit? Because one of them, literally, you just scrolled in the toolkit and didn't click anything.
Right. So the stay safe part is in the full toolkit.
Okay.
And then the My Safer at Home plan is its own document. And
Right.
that's on the website, but we'll start sharing those links in a different way too, so that it's easier to find. It's not in the full toolkit. We didn't want to make the toolkit too long or make you feel like you had to like have 30 pages of information at a time. So we tried to break some of it out. And the My Safer at Home is something that we think that you should have regardless of COVID-19. So that's why it's its own thing, but it's definitely on our website. So if you have access to the website, we can get it to you that way. Otherwise, I can always put a link to the document in the chat. I'll go ahead and do that now just so people can
Okay,
get it.
thank you. And
Yeah,
then,
of course.
so in the chat, I'd asked you a question and you didn't answer that. So can you answer that question in the chat?
Can somebody, I don't see the chat, so can
I'm
somebody?
sorry.
I can just ask the
Emily,
question.
yeah.
Yeah,
you can
just go
I
ahead
was-
and re-ask your question.
So my question was, for Iris Consultants, can that be your person for the other plan, whatever that one's called? And is it possible for an emergency contact as well?
That's something that I think that you should, like, if you have a good relationship with your Iris consultant and you want to talk to them about who the best person to be your emergency contact is, I think that's a conversation that you can have with them. I think that it's when somebody's your emergency contact, they have to agree to it. You know, it's the person that you feel the most comfortable with, but they also have to know and also be comfortable with it, because that's somebody who could get a call at 2 a.m. or need to come to where you are right away. So that's something that we would encourage you to have that conversation with that person before you decide who your emergency contact is.
And then what is the name of the other form you were going through, so I can ask her that question?
Oh, sure. It's the My Safer at Home form.
Okay, I guess I'm confused. Maybe I'll talk to Shannon privately or something. I thought the My Safer at Home one was the one that was not in the toolkit.
Oh, yeah. Okay, so there's the My Safer at Home one. That's not in the toolkit right now. That's its own separate link. And then this part, that has a place for you to write down your emergency contacts. But if you're going to report something to somebody, the steps for doing that are in the Stay Safe section of the toolkit.
Okay, stay safe. Thank you.
Yeah,
And
sure.
Emily, I'm happy to, if you have any more questions, you can give me a call, or we can do them by email. So however you'd like.
All right, thank
But
you.
I think it's good. It's good for us to hear from people if they have suggestions about the toolkit, how we can make it easier for people to understand.
Yeah.
So we're at noon. So I think we're gonna end this, and thank you to Mitch from Disability Rights for joining us, and to Shannon and Caitlin for helping us all get online in several different ways. And again, as I said, tomorrow we're going to be doing this at 11, and it will be the Stay Connected portion of the toolkit. So thank you all for joining us. We really appreciate it.
Thanks, everybody.
Thanks.
Thank you.
Mitch.
Bye.
Bye.
Bye.